Hey YouTube, welcome back to my channel. This is my third installment of 30 videos in 30 days. My name is Dr. Kaplan, and my mission is to make psychology accessible to the whole world, basically. So I get this question, what are panic attacks and what is a panic disorder? So in this video, it's all about panic attacks. I'm going to talk to you about what the symptoms are, who's more prone to them, and then I'm going to end with a discussion how we assess panic attacks and panic disorders. So here we go. Panic disorder is an extreme anxiety reaction that can result based on a real threat or even an imagined threat. So the question is, how are panic attacks different from a panic disorder? Well, a panic attack is a periodic or short bout of panic that usually comes across us, hits its peak in about 10 to maybe 30 minutes and passes us, and then it's gone. But in order to have a panic disorder, a person has to either have recurring panic attacks or they have to have a fear that they might have another panic attack. So it's this unforeseen, unprepared panic attack that occurs fairly repeatedly. And we look at symptoms for about a month. So the panic disorder is diagnosed in a shorter time span than many other anxiety disorders, which are about 6 months. So here we're looking at about a month of behavior, and we want to see what symptoms you have, and we want to see how it interferes with your life. So oftentimes people with a panic disorder, they might think that they're either having a heart attack, they're going to die, they might think that they're going crazy, or that they're losing control. And the reality is that this panic attack occurs when there's no real threat and the person isn't having a heart attack, and the worst fear isn't going to happen, but nevertheless panic sets in. So when we think about this, more than about 1/4 of all people, 25% of all people, will have at least one, if not more, panic attacks in their lives. But that doesn't mean that they meet the criteria for a panic disorder. So in order to have the diagnosis of a panic disorder, it has to either be recurring panic attacks for a month, or the dread or fear about what if a person would develop panic. And people who have panic disorders, it really interferes with their life. So you start to see dysfunctional changes and avoidance behavior as a result of these panic attacks. So ultimately, there's a lot of anxiety or worry about when a person is having a panic attack or possibly a future attack. So we know that the symptoms have to last for about a month, but in order to be diagnosed with the condition, you need 4 or more symptoms. And here are the common symptoms. And I'm going to show you a screening instrument at the end of this video, but these are the common ones. A person might feel like they're choking, or like that there's pressure on their chest, it's hard to breathe. They might feel like their heart is racing, or they might have blurry vision, or chest pain or dizziness. And these features are common in people who are having a heart attack as well. So many times people who've never had a panic attack, they think that they're having a heart attack, and then they call EMS, they hook them up to an EKG, and they discover that they're having a panic attack, and it's not an abnormal heart functioning. But people also feel dizziness and nausea and fear of death. There's this dread that can come upon people, and you could get pins and needles or tingling in the hands and the feet. Now, every person who has a panic disorder, their features are going to be different. So we have to make sure that we ask about what their panic disorder looks like, or we give a screening instrument to get a better understanding so that we don't use a one-size-fits-all approach to treatment. But when we look at, well, how common is this issue of panic disorders? Well, it's fairly common. We mentioned that in terms of panic attacks, about 25% of people will have a periodic panic attack. That doesn't mean that they all meet the criteria of a panic disorder, but it's pretty common. We see gender differences. We know that women are twice as likely to be affected by panic disorder and panic attacks than men. We also know that people who are poor or low income are about 50% more likely to develop a panic attack or a panic disorder than wealthier individuals. And this is due to sociocultural stressors. Now, the prevalence, if we look across racial groups, it's fairly about the same. And we see the incidence rate across the world in comparison to the United States is about the same. Now, we do see an uptick in the percentage of people seeking treatment. If you go back to my video on generalized anxiety disorder, I mentioned that about 25% of people seek treatment. In panic disorders, it's about 35% of people with panic disorder that actually seek treatment. And the reason is that it's harder to function. There's more debilitating features, and you can't go on life as usual. So it's also important to understand that the DSM-5 separated out the diagnosis of agoraphobia. So you can have a panic disorder. It can be accompanied with agoraphobia. It does not have to be accompanied with agoraphobia. But if you go into my video on phobias, I talked about agoraphobia, where people might be afraid to leave their home or to travel or to go into locations where they may feel like it's either they're unable to escape or they're not going to get the help they need. And obviously, agoraphobia is different from person to person, so the intensities do fluctuate. And I would say that more modern research has identified the panic-like symptoms that can occur. And there is a connection between having panic attacks with agoraphobia as well. So you can have panic-like symptoms with it. So that's the video. Now, I also want to show you a screening instrument before we end this video. In practice, as a clinician, how do we assess or screen for a panic disorder? So here we go. This is the panic disorder self-report scale. It's one of many different assessment instruments we could use for a panic disorder. And keep in mind that it does not mean that you have to have 6 months. But in this particular instrument, they ask for 6 months. During the last 6 months, have you had a panic attack? Yes or no? Or a sudden rush of intense fear or anxiety. And then once we know that they had a panic attack, we try and get, okay, when was it most recent? And then we try and better understand it. So if they said no, they didn't have a panic attack, there's no reason to go through the rest of this instrument. But assuming that a person did have a panic attack, then we would try and understand more about the qualities of it. So then we would ask, well, did it come out of the blue? Did it happen more than once? And then here's where we get to the diagnosis criteria. Have you ever had worry a lot for at least a month about having another panic attack? And did you ever feel like you were losing control or going crazy? Which is, there's a stigmatized language here, but that's part of the instrument. Or having, a heart attack. And did you change your behavior? Did you avoid something for at least a month that you once liked to do? And that's the dysfunction. We want to see how it's impairing your life. And now these are the same features that I talked to you about in the screening or the diagnosis. Now, there are some extra ones, but again, this is a great instrument for trying to see, well, what features of panic are they experiencing? So all in all, that's the instrument, but then we can continue and then continue to see, well, what are additional qualities? How much does it interfere with your functioning in daily life? So when you had this bad panic attack, which takes minutes from the point that it begins to end, how bad was it? How distressing was it? And so forth. And then I like the last two questions, because in order to get a diagnosis of a panic disorder, we have to rule out other possibilities. So it cannot be that you had these features due to some kind of drug exposure or coffee. So whether it be caffeine, well, if you drink too much caffeine, you might induce a panic attack or jitters, right? If you take excessive amount of cocaine, you might have that. So substance abuse could induce panic-like features. And then there are other medical conditions that we have to rule out as well, such as hyperthyroidism, a cardiac factor, any of these additional things that might contribute. So that is a very brief explanation of what panic disorder is, how we diagnose it, and a screening tool that I like to use in clinical practice. So if you found this video useful, hit the like button, subscribe to my channel, and click the notifications icon, and that will allow you to have access to future videos just like this. Take care, everybody.